about being back in daycare?
Playing with my friends.
A group of Quebec doctors is asking the government to ease social distancing measures for children under 12 in schools and daycares, saying their health is at risk from a lack of social interaction with other children.
I can still play with her.
With children, there's a critical window in the development that they have to acquire some milestones. I'm afraid that they could have permanent consequences because they didn't reach this milestone or they didn't interact enough when they were 18 months, 2 years old, 4 years old.
It's time for children to play together. That's what a group of 13 Quebec doctors say in an open letter to the provincial government. In only 24 hours, over 1,000 doctors signed the petition asking to drop protective gear for children under 12, stop the 2-meter distancing rule, and bring back sports and group play.
We have the data. Children, they almost never get COVID. If they get it, usually they don't have symptoms, or if they have symptoms, it's going to be mild. And if they have mild symptoms, the risk of transmission from one child to an adult or to another child is very low.
Yasmin Gandor runs the Orchard House preschool, where staff focuses on cleaning and hand washing, but says it's impossible to keep children 2 meters apart at all times.
The idea is to try to encourage them to have a little bit of distance when they play out in the yard. We've reconfigured the yard, for example, so that we have smaller groups who are playing so that they don't have to not that many children have to interact with one another, but they're still playing with each other.
But what about that Kawasaki syndrome? Doctors at Montreal's Saint-Justin Hospital reported in May seeing between 15 to 20 cases in children, a fever and rash thought to be linked with the Covid-19. But Dr. Groulot says the studies on the syndrome aren't conclusive.
What I've heard, what I've understood is that this disease, it's rare. And when it happens, so it's very rare, but when it happens, up to now, it doesn't leave any long-term consequences.
But is that enough for parents?
I think at a certain point we do have to weigh mental health. So I definitely agree with that. Kids need to get back to normal.
You know, we have to take risks daily. So it's sometimes you just have to go with the flow, I guess.
In Montreal, Sharon Yonan Reynolds, City News.